This part two for chapter 9. We'll be looking at continuing with looking at uh, medical and health insurance, in other words, protecting ourselves. In this part, we're going to be looking at the government healthcare programs and also disability insurance. Now, when you start talking about the government, the main thing that people think about is Medicare. Medicare is the federal, or in other words, the U.S. government funded health insurance programs. Now, this is for retirees, people who are 65 and older, and people with disabilities. And you'll see that there's 4 parts to it. You have part A, B, C, D, that sort of thing. And what we'll do is look at each of those. Part A is the hospital insurance. So if you are hospitalized for some reason, you break a leg or you need some kind of surgery or something like that, Part A covers that. Now, it only covers 80%. The other 20% is on you. Part B is the medical insurance. What that does is that covers doctor's services. So in other words, if you go to your physician and that sort of thing, or you have surgery of some sort, it's covering all of the doctor stuff. Again, at 80%. You are on the hook for the other 20%. Part C is a Medicare Advantage plan where it will kind of fill in some of those gaps, and it combines parts A and B. Part D is the prescription drug coverage. In other words, if you have to have some sort of scripts for high blood pressure, something like that, it covers that. Now, with that, you also have a copay that goes along with it. You also have what's called Medigap or MedSup policies. That's coming from individual insurance companies. And what they do is they fill in some of the gaps as far as Medicare Part A and B. Now, just to let you know, Part A is free. You don't have to pay anything for that. Part B, you do have to pay it. I think it's like $135 a month for Part B. Then you have your Medigap or MedSup. In other words, it's supplemental to the other insurance policies. And I think I pay something like $140 a month on that to cover all the other stuff that Parts A and B do not cover. Medicaid, on the other hand, is run by the state. Now, states do this for low-income folks. And you can see the benefits that they typically have, for doctors and hospital services, lab care, glasses, preventive care, things like that. One of the things to think about is combination. If you are low income, underneath a certain level, and let's say you're a retiree, you have your Medicare that's covering the major part, and then you have your Medicaid that will help cover what the Medicare does not pay. My brother-in-law is retired, and he's currently dealing with cancer at this point. The Medicare is covering a majority of it, and then the Medicaid is paying for pretty much the rest of it. Now, one of the things that came out in 2010 was the Affordable Care Act. Now, it's the Health Insurance and Patient Protection and Affordable Care Act of 2010. That's the full name. Most people call it the Affordable Care Act or Obamacare. The whole idea behind this was to make sure that everyone had health insurance. It is not health care, it is health insurance. And what they were trying to do was set up various tax credits, high-risk pools, things like that. And they put things in there where you could be covered under your parents' policy up until your 26th birthday. And you could not be denied insurance for pre-existing conditions and things like that. In the original Obamacare or Affordable Care Act, it also required you to have insurance. You had to purchase insurance in some way. If you did not, then you had to pay a fine through the IRS as far as taxes are concerned. That has been done away with. In 2018, Congress passed a law where you did not have to have the insurance. It took away that whole idea of having to pay or having to buy the insurance or else having to pay that fee through the IRS. That's the individual shared responsibility piece, where you had to have that insurance, otherwise you paid a fine with your taxes. That's gone away. Now, with the Affordable Care Act, it said these are the minimal things that any insurance policy has to have. Outpatient care, trips to the emergency room, hospitalization insurance, maternity and newborn care, mental health services, addiction treatment, prescription drugs, rehab services, lab, preventive services, and pediatric services. Now, the thing is, every insurance policy has to have these. Because every insurance policy has to have these, it's actually helping to increase the cost of the policies. And the thing is, somebody like my wife and me, we are past childbearing years. We don't need maternity and pediatric services. However, our insurance has to have it based on the Affordable Care Act. The whole idea behind the Affordable Care Act was if everybody has the insurance and you have people who are very healthy, who are a part of this entire pool, then what that does is that they are paying a little bit more, and that covers those who are less healthy and are higher risk and spending more money on insurance. However, the people who were most healthy decided not to be a part of it, and it really pushed up the overall costs for insurance. Now, there could be some exemptions as far as you having to buy the insurance. In other words, something that's not affordable, or you've been out of work for a certain length of time, then you could get away with not having insurance. You would have an exemption that goes along with that. There's different websites that will help you find some of the health insurance information that you might need. And then disability income insurance. The whole idea behind disability insurance is if you are hurt and you cannot work, it will pay you a certain amount to help cover the paychecks that you are missing. Typically, disability insurance will pay anywhere between 60 and 70%. If you are working for a company and they have a disability insurance option, it's typically about 70%, and you can have a buy-up. You can pay a little bit more every month and have a buy-up to 80%. So in other words, a little bit more as far as your typical monthly income to be covered. Workman's compensation is insurance that a company has to buy. If you get hurt on the job, they have the workman's compensation insurance will pay you something like 60, 70% of your income that you typically would get. However, the workman's comp policy is actually purchased by the company. You might have employer plans. Okay, in other words, you can get disability insurance from your employer. Social Security will actually cover long-term disability. The thing is, there's a 6-month waiting period. In other words, the short-term disability has to be satisfied before the long-term disability of Social Security kicks into gear. And you have your private income insurance programs, and they'll pay a certain amount depending upon the policy. Now, the trade-off on that, first of all, is the waiting period. You're going to have anytime you're going to file for disability insurance, you're going to have a waiting period of some kind. It might be 30, 60 days, might be 3 months, something like that. It also will have a limit as far as how long those benefits will last and the amount of those benefits. And it's really kind of interesting because with disability insurance, it says that it will cover certain things based on certain injuries. So in other words, if you lose, if you go through the policy, it's really kind of interesting. If you lose an eye, they'll pay a certain amount. If you lose a leg, they'll pay a certain amount. I mean, it's really kind of morbid as far as the way they set some of those things up. But what it does is it covers you in case something does happen to you that really does impact your ability to work. Medical costs have gone up tremendously over the years, and there are various reasons for that. All the technologies that we've put into place, so for example, the MRI machines and various other things, very, very expensive. Duplicate tests. One of the issues that physicians run into is it is a very litigious society. Somebody is not happy with the physician for some reason, they sue for malpractice. So one of the things that happens is physician insurance costs, in other words, malpractice insurance, is sky high. It's amazing how much they actually have to pay per month for malpractice insurance. Because of that, they might be doing duplicate tests. They might be doing things, many more tests, just to make sure. Another issue that's coming about is more the quality aspect. If you return to the hospital with that same indication that you had before, so let's say you had pneumonia, you went in the hospital for a couple of days, you come out, within another week, you're back in the hospital with pneumonia. That is a real knock against the hospital, and the hospital actually loses funds because of it. And so consequently, doctors and hospitals are very much more careful as far as making sure they're doing the tests and everything to see if you are available to leave. The elderly are living longer. In other words, the amount of time, the number of years that people are actually living has expanded. Might hear, 60 is the new 60 is the new 50 or something like that, because people are taking better care of themselves overall. There's all kinds of regulations and things that came about from the Affordable Care Act as far as record keeping and some of the other things that are happening that takes up much more time as far as administrative types of things. That's increasing the costs for healthcare. Increasing emergency treatments. One of the things that's happening is a lot of people don't have primary care physicians. Consequently, if they're sick, they go to the emergency room. And that's expanding the amount of time that people are spending in the emergency room and the amount of money that's actually costing everyone. Some people are using more medical care than they should. In other words, you have a lot of folks who are, if they just have a cold or something, they're going to the doctor rather than just going to the drugstore and getting some over-the-counter stuff. They're going to the doc. So there's a lot of things that are increasing the cost of healthcare today. This graphic is kind of interesting where they're projecting how much is actually going to be spent on healthcare, health expenditures over the coming years. So what's being done about it? One of the things that you have to think about is look at any kind of bills that you get and really kind of shop around. First of all, shop around as far as physicians are concerned. If you have to have some sort of surgery or something like that, shop around as far as the hospitals are concerned. Think about prepaid group practices. There you hear about various policies and groups on the radio, for example, that advertise to say, hey, you join us and it costs you much less. So it's really kind of interesting some of the changes that's going on to try to bring down the cost of healthcare. The other thing is paying cash. It's interesting. If you go to a doc and you say, okay, I have this going on, okay, and they say, okay, do you have insurance? If you have insurance, it'll cost you X amount. If you do not have insurance and you're paying cash, it's going to cost a lot less. It's really kind of interesting what it is that's actually going on with that. So what can you do to reduce your costs? Think about a flex spending account. What it does is it sets aside, it saves you tax dollars whenever you are paying some of those bills. Think about a high deductible health plan, but it's just like, high deductible as far as your car insurance is concerned. Are you willing to pay that higher deductible? Can you pay that higher deductible? Whenever you go to the drugstore, ask for generics versus the name brand medicines. Think about if you have something where you're having to buy drugs over and over and over again. So let's say that you have high blood pressure. Many times you have to continue to take the high blood pressure medicine. Well, if you use a mail order type thing where you're buying more in bulk, it can save you some money there. Think about pharmacy physician assistance programs, pharmacy assistance programs. There are things that you can get, like an app you can get with your phone, where it actually reduces the cost of the prescription. Really challenge the idea of follow-up visits. Make sure you're reviewing your statements for billing errors. It's amazing how many errors are actually made on any kind of billing. You look at, you get a bill from the hospital and it might be pages long. You have to go through there and challenge some of the stuff. Did this really happen? Is it really right? Best way to avoid the high cost of illness, don't get ill. All right, so eat a balanced diet, keep your weight under control, get plenty of rest, drive carefully, things like this. That's it for Chapter 9. If you have questions, please give me a shout.